Welcome to the Mindset Mirror Connection podcast. In today's episode, we're going to talk about PCOS, Polycystic Ovarian Syndrome. Y'all are probably thinking, what the heck is it? We're going to give a full detailed explanation, what it is, the subtypes, the type of person who gets it, common symptoms, and then lifestyle, supplemental, and medication changes that you can make to see results. So if you're ready, listen up and lean in as we elevate your mind.
Welcome.
Hello. We are not together because I am a little bit under the weather and my little baby cannot get sick. You're my baby with the baby.
Before I would have been like, oh, yeah, you're fine. But now I'm always like, man, it would really suck to be sick right now because I'm already so horizontal in my life.
I would love to be horizontal right now.
I'm horizontal a lot lately. So it's like, if I have to be horizontal more than I am, it's like, I have to schedule it.
Well, and COVID's pretty I've had a lot of clients with COVID. Have you?
Yeah. My mom had it a couple weeks ago. And apparently, so she kept testing positive. And I was like, okay, like these tests are fake or something. I don't know. Like there's something going on. And my dad would test negative. And then she ended up going to urgent care. And they told her that like you can still test positive even though you don't have symptoms, like if you're older than 60.
Oh, interesting.
I know. So I was like, oh, that would be good to know. I mean, for speaking of like the majority of people that get it.
Yeah. Well, my client in Portugal, it's interesting to hear her perspective because it was rampant there, like was going through her because she had to work like crazy hours because all of her colleagues were getting it.
Oh, no.
And she was just saying like, we don't have the antibodies. So, and because we don't have the antibodies, and I don't know how this works, but she was trying to explain like, we don't have like a flu season with COVID because we can't kind of like understand the cycle of it. So it just kind of comes, which I don't know. I feel very like nauseous. I was on a call with Desley. I go, I might have to go vomit. I just drank some water. I felt better. Nauseous. My nose won't stop fucking running. I don't have a cough, but I feel because my nose is running, and usually my nose doesn't run. I know if you guys, I've talked about my allergies. Usually it's post-nasal. It's both. Just lethargic. So, I mean, I was telling you before we came on, like I started getting really bad headaches for days. I would have headaches and I thought I was going through a cycle. Right. Yeah. So I was talking to Jenny about it. I was like, I think about because it's around the same time I cycle, but I think I was just fighting it off and I have really bad seasonal allergies, but I take a Zyrtec and I do Flonase every day until my doctor told me until it hits 100 degrees consistently. Because that like kills everything off, but I feel it in my cheeks, like the sinus pressure in my cheeks, and that's the worst pain because it's just like painful in my teeth. So I always know that's always something that comes on. But I've had chronic sinus infections forever, and my client Rachel, she did too, and she got one of those like where they go in and kind of clean out the sinuses, and she had issues for months because of that. Because initially it was like, oh, I'll do that. And then she did it and she was like, don't do it.
No. And like as an adult, it's really rough too.
Oh gosh, I can't imagine. I had a coworker at Child Help, Sam, and she had like a surgery and then she too had all of these issues and she had to get like multiple like treatments after that. So I'm glad to keep you safe.
Yes.
That's what I
was like, I'm probably fine, but also ugh.
I don't think people care if we're next to each other. Now, I like to be next to you.
I like to be next to you too, because I feel like, because sometimes when you start talking, like in person, I can tell that you're still on a thought, but in the computer, sometimes it's hard to tell that you're still on a thought. So I try not to interrupt, but then I sometimes feel like I interrupt and then sometimes I feel like I leave blank space, but then I think, whatever.
It's fine.
It's fine.
What's new in your world?
Today I had an interesting experience with UPS. Let me ask you this. So say you have something that you want to print that's rather large, right? Mm-hmm. And you send it to UPS to be printed.
Yeah.
And you go to UPS to pick it up And they say, oh, we don't have it yet because our delivery truck hasn't come in. And I go, correct. Thank you for your face. And I'm looking around and I'm like, there's 3 large printers in here. Why wouldn't you just print it in the office that I sent it to?
Right.
Okay. So that's all I wanted to know. I just wanted to know if I
maybe
was
they were out of paper.
Well, then say I'm out of paper on the door or something.
Yeah. Oh God.
So I was like, I just think he's very confused. So apparently I'm going to get a call later today that my document is ready, but because I ended up, so I ended up printing a course because, so it's an online course, which I don't do well with, but I'm going to really try. And it's like their workbook for the course.
Mm-hmm.
And I didn't want to do it online. I do better with writing it out too. Mm-hmm. But it's a course for my birth because I saw a provider on Friday and she was asking me like, what's your plan? Like going into birth? Like, are you going to do it medicated, unmedicated? And I was like, the goal is unmedicated. Mm-hmm. And I got a very interesting look of, you probably want to prepare for that level of what you're going to go into. Because I was thinking like
of pain.
Yeah, like I'll just go into it and like focus on my breath and kind of be moving throughout the day and like know which stage of labor I'm in, and then we'll go to the hospital. But then she's like, you probably want to just like take a class or something. And so I started looking up classes, and then this chick like had on a discount where there was a bunch of stuff included and it was like a reasonable price. And I'm a sucker for like, that's fine. So then I was like, well, I need to print out this workbook. And so it's like 80 pages. So I don't want to print it at home. That's what I was printing.
Oh, so, nice. Good. So nice. That's exciting. Yeah. That sounds kind of scary too.
Yeah. Like I go, I don't know what it's like, and I'll cross that bridge when I get there. Excuse me. But ideally I'd like to just go full send into this. So we'll see if that actually happens.
You and Sonia, man, she was going to have a birth at home. She did it for her second baby.
Did she?
The doula on the first one was like, nah, kind of abort mission. Not really, but yeah. So it's you guys are brave. I'd be like, all the drugs. Actually, you know what? Do I have to be here for this? Let
us show up.
Get me out of here. Speaking of, okay, this is funny. We have a whole banter list, but now I'm like, oh no. Did you hear the cat lady comment
about how Kamala's a cat lady because she doesn't have children?
Yeah. Like, stop it. I know. I was so offended by that. Like, I don't have kids. Also, while I didn't want children, I didn't have a choice in doing that. Like, and I was still in the years that if we decided to have kids, we could have. Right. And I just love how women are stepping up after that. And it's not even political. Like, I think, again, it comes back to like the abortion conversation we had of like, women can do whatever they want. Like, if we don't have kids, we don't have to have kids. Like,
I know
that has nothing to do with our character as people.
Well, even like when Michael and I were discussing having kids, we used you and Mark as an example of like what life would be like without kids. And we were like, God, their life looks pretty good. I mean, and a lot of their friends don't have kids. So like, and they all seem really happy. So, and we were like,
it was crazy. I was listening to Megan McCain, man.
She's your girl. She's your new girl crush.
I had him listen to it on our way back from Vegas. Oh, really? And he was laughing because like she just says the most raunchy shit and it's fucking hilarious. And she's like, she calls herself like a middle left, right? Like our middle right.
Middle right.
And, yeah. And I would consider myself just in the middle. So I don't want to be put in any sort of box. But I like, the things she was saying, and she was saying even like conservative women are like, no, dude, like you're trying to come after IVF, abortion. Now you're saying if you don't have kids, you're a piece of shit. You know what I mean? And I don't think the ladies like it. So we'll see.
I don't really like it.
Yeah. Like you can't have a baby either, sir. So shut up. Stop talking about women's reproduction. So annoying. And take off your fucking eyeliner.
Does he wear eyeliner? I haven't really looked at him.
I don't know. I saw some memes on it.
Okay. So obviously it is true.
It's obviously true. Oh, I just watched Jen Gottlieb's interview. I sent it to you with Lane Norton, who I absolutely love. He was actually one of the first. Lane Norton and Mike Matthews were one of the first like influencers, if you will. I know they wouldn't consider themselves actually. Norton is obviously a doctor, but that I actually started like listening to. I actually had a pretty close relationship with Mike Matthews' program, not him specifically, but they sent me a bunch of these books. They sent me 10 of each.
Wow.
Thinner, Leaner, Stronger, and Bigger, Leaner, Stronger to give to like my community, which was cool. But yeah, he was, hold on.
I like Lane Norton.
Yeah. What were we talking about?
I don't know. We were talking about how they came up in like social media and something with Lane Norton and Mike Matthews.
Jen Gottlieb. I don't remember now.
And Jen Gottlieb. You're listening to their podcast.
I don't remember now.
That's fine.
My sick brain.
Well, I learned from a friend last week. I guess she's doing some social media stuff. I don't know. And it makes you realize like how much you don't know about social media and like how to work it. Because she was saying,
tell me
like
more.
What I know, right? Okay. So, because I was wondering, I was like, do we do this on like your coaching Instagram page that you post a reel and what you do is like essentially have like a group of gals that you're like support group with. And so every time you post a reel, you tell them. So then they can all comment and like and share it. So then it reaches their audiences. But when you do that, so say like I post a reel, you comment on it. And you know how you can like swipe, I think left now, and then I can post your comment to the reel on my stories.
Oh, I didn't know that.
I didn't say me either. I learned that last week. Good. So you do that. But then there was something out like, so you do that. And then that way, then it gets more attraction too. And so you have this group of people, then you got to tell them that you do it and then you repost it, but then you got to share it in your stories. And then most people, I guess, are looking at stories now, not like the feed, because the feed is all advertisement. And I was like, oh, I know. Oh, I was like,
well, Beverly does say to like repost your reels and your stories and then post you talking about it in your stories. I didn't get time for that.
Yeah, I don't got that. I don't have like because she was talking about it and I was like, see, this is so flabbergasting to me because that's not how I use Instagram at all. Because if you go to the top left and you click like the followers or following, it creates a drop down menu and you can just click following and then it gets rid of all the ads. So you can just see what people that you follow are posting.
Oh, I didn't know that.
Yes.
Oh,
that's how I know. So I'm like, that's how I use it. So I don't see like, and I was like, and I honestly don't look at stories that much, like unless it's like the same 6 people. And then that's all I kind of do. So it's like, I don't even understand how to use this because I don't use it how you're supposed to be using it.
Right. That's funny.
I know.
Yeah, no, that's really interesting. And I have to say, we had such an amazing outreach after our Q&A where both of us, I cried and our client and our listeners cried and they sent us yes, they're like, you guys are amazing. Like, don't listen to these other chicks. Like, we're not doing 3 ways to lose fat. We're changing the world. And it's like, yeah.
Okay. Like,
yeah.
We'll keep going.
Bitches. Like,
I know. Well, it's like you forget. And then, so like, for example, my girlfriend that worked with us, starting in January, she was the one that like didn't work out. Like we just said, let's walk, and she would go hiking once a week and she'd schedule that. And she wasn't eating enough. And so then we just made sure she had like planned, like Monday, she would have like pasta and spaghetti and like meatballs. And then Tuesday she would have whatever. And so she just had the same 3 meals and she ended up losing like 15 pounds. Wow. And like, yeah. So eating more, doing less, wasn't stressed, went through a divorce during this time as well. 2 young kids. And so we had worked with her. And then at the end of the 4 months, she's like, I think I just like need a minute, because I'm glad I did this. I'm not saying I'm not going to anymore, but she ended up texting me because I've still seen her because we've been friends since high school. And so she ended up texting me yesterday randomly and was like, I just want to let you know I'm working out 3 to 4 times a week now. And I still do our planned meals. And I just love my body and I feel so good in it. And I'm just so grateful for you. And I was like, oh, damn. Like, good.
Yes.
Yay. You're like,
again, we are, and one of the gals I was texting with was like, I'm like, can't make mindset sexy, but and then she was like, well, that's the fucking work people need to do.
Yeah.
Yes, it is.
Yes, it is.
Yes. No, but I since then have continued my kind of practice that we talked about on that podcast, and I made a new vision board. And on the top, it says top new podcast.
Oh,
right there. It's hard to see though. So I need to like prop it up, or I need to redo. Can you hear me? I need to redo it. But
how do you do the vision? There. Do you like just make a completely new one, or do you like take off?
No, you know I have. Well, the one that was back here, I used some of the stuff in it because it hadn't come true yet. But I have the first one I did over there on that wall, and that one was about like love because I was single.
Oh,
and then that, and kind of like more just around like creating the practice of just being very positive and looking at what I'm grateful for. So it says things like she believed she could, so she did. It has like some silly stuff like Louis Vuitton, which I got. That one over there is when I was in sales, and it's talking about like building an empire. It has a cutout from where I used to work, their President's Club. It says President's Club. And the funny thing is above that is my same year President's Club award.
I was going to say, you were very successful at that job too.
Yeah. So that one was more around, the sales aspect of things. I was already with Mark, so a lot of things just like enhancing our relationship. The one prior to this, what I realized was all about travel.
Oh, how ironic.
Trip. Yeah. It did have a New York Times bestseller on it because that's when I had launched my book, but I put that part of it back in there. So it says New York Times bestseller. It says Nashville. It says like strong and sexy. And more importantly, committed to changing the industry.
Okay.
So I make a point of looking at it every day.
Yeah.
So I did my new vision board. Oh, and how I do it is I buy this green sparkly. If you're looking on YouTube, that one has green sparkly. The one before this has green sparkly. That one my girlfriend gave me. She found this like tissue paper you would put in like a gift, and it said all these positive things. So I use that as background, but it's green because green's good luck. And then I buy little stickers. So there's like a private jet right in the middle. And I cut out stuff. We get the Phoenix magazine, so I use that.
Okay. Yeah, I do. I've got a list. I actually need to do it because I haven't done it in a while. In my phone of what are we in? We're in August, July. So what I end up doing is, say I'm going to do it in August, I do a 1 month, 3 months, 6 month, 1 year, 3 years, 5 years goal. And then right now I'm thinking about it and I'm like, oh, I need to go back in and like update it and see where I'm at. And so it's really interesting because I started it in September of 2019. And I just like go in and I cross off everything that actually came true. And so let's see. Let's go to where I'm at. So I got this. So even like, so it's 6 months for 2024. So 6 months but that was technically 5 years from March, whatever. Anyway, I have like pregnant, which I was like, whoa, I'm pregnant.
Wow.
Yeah. Like more sense of calm with who you are. And I'm like, that's true. And I've got my doula picked out. And then I have like goals for like clients, like how many I've got with us. Or even like March 2024, my goal was like audiology 3 times per week, making more from training than audiology. That's crossed out. Obtain raise, crossed out. A goal for like my Vanguard account, crossed out. So I'm like, oh, cool. Like,
yeah,
forget that those are your goals. And then once you kind of put them out there and then you see it and repeat it. And then you go back, you're like, hey, yay for me.
Yeah. You got to do it, guys.
Yes.
It's something, and it's not just putting it on there, but like looking at it every day.
Yes.
It's very important.
Yeah.
And it's just crazy. I mean, everything I was worried about literally turned around, and we've been getting a lot of clients. Thank you all for the referrals. We were like slow on referrals, and now they're like coming in. And it's kind of funny. We have like a handful of referral webs, as I call them.
Webs.
So like Erin, number one, who I'm interviewing. You guys will definitely love that interview.
Oh, our Erin. I was like, which Erin? The Erin M.
Yeah. Erin and I started working together in 2020.
Yeah.
2021. And we've gone through wedding, honeymoon,
baby,
the aftermath, pregnancy, and then you took over, went through pregnancy. Now she's back with me and going through just getting her back to a good place and feeling good in her skin. And but the web is Erin has literally like, I think her alone, she's referred probably like 6 to 8 people to us.
Mm-hmm.
And then we had Abby, who was someone I coached in person. Then Michaela, and then a web of people from them.
Mm-hmm.
Then I had Lydia, and then a web of people from her. You know, it's just like funny how like you have these like little. Oh, and Nina's another one. Have people come from her. So thank you guys. We love referrals. And we've been getting such good feedback on the program, the self-guided program. And Sarah, she said, I don't know how you're going to fit another 13 weeks into this, because every week I'm like, fuck, I need to fix that. Like,
that's funny. I know, it's funny. I wonder, I'd be curious to see if any of my referrals for that went through, because so I was on Reddit naturally, and you have to get a little strategic with Reddit, because if you post on, like, if you promote, they'll cancel you out from the group usually. Gotcha. So someone on there had posted a thread of like, hey, I'm a personal trainer. Like, I'm really realizing that the psychology aspect of this is not being touched on. And so does anybody have any like resources or anything like that to help? And so I was like, is this on? I was like, hi, funny you should mention that. The gal I work with, that was what her program is based on. I said, she's, this is her background and this is how we help clients. I said, if you're interested, please reach out. And I had like 5-6 people reach out and be like, hey, what's this program you're talking about? So I sent them the self-guided thing. And then I said, here's the website that has like all of our information. And then I said, here's our podcast where we talk about psychology things. I know. So I was like, plug, bitch.
Yeah. Love Reddit for that. That's great. Actually, Thanks. We've had a lot of people sign up, so I'll have to look to see. On the affiliate side, I'm not seeing anything, but again, this is all new. Fine. So either way, yeah.
That's the thing. I don't even know their names, because I only know their like their username.
Yeah, they're like little character. I look at the stupidest shit on Reddit. I should probably use it for work. I don't remember what I was reading the other day. Anyway, what else? How's anything new in the birth? Your baby?
I got my breast pump.
News.
So that's about as exciting as we got. People are very concerned that I'm not having a baby shower, that I have no plans for a nursery, and that I have no equipment.
No.
I'm like, it'll be fine.
Your like, body, your baby, your choice.
Well, also I'm like, I just need to send out our registry, and like Michael and I just need emails for that. That's easy. And then we just go from there. Like, I mean, the baby shower is nothing.
Does anyone actually, okay, ladies, do we actually want to go to a baby shower?
No, baby showers are the worst.
Agreed.
That's why I don't want one. Like, that's why people are like, you're not going to have a baby. I'm like, hell no. Have you been to one? They're so boring.
They really are. Bridal showers, fun. Baby showers,
not fun. Well, and like, you're going to watch me open up a onesie and be like, oh, great. More diapers. Yay. Thank you so much, Christina. Like, let me get the next gift. More diapers. Thank you
more
so
diapers.
much. Yeah.
Yay.
Like, no. So no, absolutely
can't do it.
I know.
Wait, you guys. So I was going to say, did you have a bridal shower? Never
No,
mind.
'cause that we didn't. I canceled that before it could happen.
Yeah. So we didn't have a registry. Neither did Adrienne.
Oh, for the wedding.
Maybe she had a little one, but I told her this weekend, I go, I didn't buy you a gift. She goes, you gave me enough gifts.
Yeah.
I was like, sorry, I didn't buy you anything for your wedding. We had a honey fund.
Oh, that's fun.
So people just contributed to that, which was
Yeah.
great. And then we went to St. Lucia. So speaking of that, we're trying to figure out our holiday trip. So for clients listening, we do take a week or so off for the holidays. But we do have some like fun challenges that we do and like group coaching. However, I think we're going to do a warm holiday this year.
A what?
Like a warm weather instead of going to like Breck. We went to Breck 2 years in a row. So I think we're going to do like the Caribbean or something with the family.
Fun.
I know. I'm excited. I talked to his sister yesterday. They're scheduled because the way that the holiday is weird. So Christmas and New Year's is on a Wednesday. So the kids go back to school on Thursday.
Ugh.
Yeah. I'm like, just let them have the whole freaking week.
I know. Like our education system is already so fogged. What does it really matter? Like those
we had 2 weeks off back in the day. Why don't they have 2 weeks off?
I don't know. One of my clients, she was doing her check-in and her kids start school on Friday. And I was like, why would they? Okay.
Why would they do that to the teachers?
I don't know. Well, because the teachers usually go in the week before, the weeks before, and do like their trainings and whatnot. So it's not like the teachers all of a sudden have to show up on Friday. They've usually been there for the last couple of weeks.
Yeah. Sorry for yawning. I'm not tired. Well, I'm not like, I'm just fatigued.
Present.
I am.
Yeah.
I am. My dog's sick, you guys.
Again?
My other dog.
Harlem?
Yeah.
Why?
She's not doing well. So she has a UTI. Her red and white blood cells are low. Ooh. There's another hormone or protein or something in her body that's low. They're pretty concerned. They called us 1 hour before we left with the results. And I'm waiting for the valley fever diagnosis because they might think it's that. They put her on antibiotics for the UTI and she's not
responding.
She's not herself. She just sleeps all day. I mean, I would like to be there with her. She sleeps on. She looks miserable. And I cried about it.
Oh.
Huh?
She was that way last week.
Yeah. I just cry. I'm like, you can't go. You're not allowed to.
I know.
Only Brooklyn. And Brooklyn's like, doo-doo-doo. Oh,
we'll and sacrifice her.
Yeah. Then I come home. Brooklyn has like a patch of hair missing on her back.
Oh my God.
And I text Haley. I was like, what is this? And she's like, I didn't even see that. We think it's like a hot spot, but like getting hot spots on a dog's back is odd. Usually you get them like on their neck, like around their collar or their paws. But it almost feels like she's got like glue on her back. So I sat there and like cleaned it and tried to like cut the little hair off and like kept it clean. So these dogs, man, they're just costing me a lot of money.
Yeah.
And tears.
Yes.
My little babies. They are your children. Anyway, let's talk about babies or lack thereof in this case.
PCOS.
PCOS.
Yes.
I interrupt this episode to bring you our August promo, which is $1 for 1 month of the Mindset and Movement fitness training app. This app has been designed for anyone, whether you're a beginner, advanced, whether you have access to a full gym, or maybe you have dumbbells at home, or maybe you only have 20 minutes and you want to get a great workout in. If this is you, this app has been designed for you. The app includes 4-phase training programs. We have a 5-day split for someone who has access to a full gym. We have a 5-day split if someone has access to dumbbells. We have a 3-day body weight and band split if you want to start there. We have a 3-day time crunch dumbbell workout split if you're short on time. And we have core programs that you can add to any of the other programs. The nice thing about this app is that every month the workout change. The workouts are going to be designed based on the previous workout, so they're well phased so that you get the results that you desire. You also get access to our community forum of like-minded individuals to share your experience and share your workouts and your success. You'll also get access to a variety of resources that the Mindset of Matter includes in this program. So if you're ready to get in the best shape of your life, Click the link below to get $1 for 1 month. And here's the great thing. After the first month, it's $29 per month. So you'll definitely want to partake in this. Now, back to the show. PCOS can cause infertility, and it is a subject that does not have a lot of research on it. The research on it is vague. It is such a complex issue. People believe it is a ovarian issue, an ovulation issue, when in all reality, it's an endocrine issue. It's a metabolic issue. You and I have talked about, and then you shared that podcast with me. I've now been in communication with that physician.
Oh, still good.
Yeah. And it is, there's so many layers to it. Very much like perimenopause. It's, there's not enough education. So we thought, hey, let's at least give the deets of it so that our listeners can say, oh, interesting. Whether you are pre-menopause or even in menopause, because oftentimes it can present itself in menopause. This will be a good one for you because the symptoms are pretty, they're common symptoms. Specifically, too, we were talking about fertility, like irregular periods, heavy periods, missed periods, right? Those are things that we just don't pay attention to as women. We're just like, oh, my period is just really heavy. It's like, it's not supposed to be.
Right.
It's not supposed to be. Like, I have clients that like literally are in the fetal position.
Yeah. I've got a girlfriend where I'm trying to nicely be like, hey, you should probably, and kind of some of her other characteristics, I'm like, I think she might have PCOS, but I'm also like, well, I'm not a doctor or this kind of doctor. So I don't know. Right. And like you said, there's so many, it depends on which doctor you see and their criteria of diagnosis too. So she might go see Dr. A and they say, yeah, you've got it. And then 3 years later, she goes see Dr. B because she moved and they're like, no, that you've been misdiagnosed. And then I've even had a client that came in person that was going back and forth. And one of her doctors said, yes, you have it. And like within the same state. And one delivered babies, one didn't. And so she was like, I don't know who to like, which one do it? Because one was like, you've got it. And the other one was like, no, you don't. And so she's like, so what do I do?
Right. Well, hopefully this will be helpful for them and you can send it to them. So again, it's Polycystic Ovarian Syndrome. Now the name is controversial. You'll hear that a lot on the podcasts and the Instagrams that do their research on PCOS. Because it sounds like, okay, I have these cysts on my ovaries. Now, that is a part of the criteria, but it's not the only criteria. And what people don't understand is that, again, it's not just that ovarian part of it. There's the metabolic part of it, right? So our body's inability to use the energy that it's receiving effectively, and the endocrine part of it, which is hormonal, right? And obviously, your hormones dictate ovulation. If we have too many androgen hormones like testosterone in our body, it's going to skew that process. So the one thing that people don't realize, there's actually 4 subtypes of PCOS. So I want to go through that first. The most common is insulin resistant, right? And that just basically is due to high levels of insulin in the blood sugar. So we've talked about insulin before. Remember, insulin is like the bouncer at the club. The club is your cells. And if there's too much blood sugar already in the system and the club is full, the bouncer will knock on the door, look at, oh, nope, still we're over capacity. Knock at the door again, still over capacity. Normally, the bouncer only needs to knock once or twice to let the insulin kind of come in and do its thing with blood sugar. But again, if we constantly have high levels of blood sugar in our system, that door is not opening. And then we have a high level of insulin in our body because it's not being used properly. And therefore, we become insulin resistant. Insulin resistance, we're going to talk about specific symptoms, but that's the one mostly linked to weight gain, right? Difficulty losing weight, of course, but more importantly, increased risk of type 2 diabetes, pre-diabetes, and other endocrine endocrine and metabolic type issues. You'll also, again, have irregular, heavy, or missed periods, hair growth in areas you don't want it to be. So this is where I struggle because I'm, Spanish and Italian. I've got like hair growth on my chin. I always think of my big fat Greek wedding where she
Yeah,
comes
yeah,
up.
yeah. No, I would say like it's excessive hair growth where you're actually maybe shaving every
Right.
couple of days or every day.
Mm-hmm. And it's not just on your face. It could be on your back. It can be
Yeah.
on your chest. Think of like where men have hair,
Mhm.
but then also you'll have thinning hair, like in this area, like right on your
Temples.
crown of your head.
Mhm.
Right? Is that your crown? Temples?
Yes, I
Temples?
believe.
Yeah. And some other symptoms. So that is insulin resistance type. So we kind of talked about that. The other types are post-pill PCOS. So it looks very much like insulin resistant type, but when you stop taking birth control, specifically progesterone containing hormone. So like an IUD would be something like this. The pill suppresses the estrogen production in your body, right? So you are taking this synthetic hormone, if you will. And once you stop taking it, it can lead to higher levels of androgens in your body and very much it produces, not produces, it, your body for a short amount of time is in this PCOS state. Now, oftentimes it can relieve itself on its own, but sometimes it doesn't, right? And this is really important to think about, guys. When were you put on birth control? Because I wasn't put on birth control till like my 20s, but I know a lot of people.
I was 15.
Well, okay, let's talk about that. When did you start your period?
Well, my situation's a little different. That was okay. To really get, vulnerable here. That was when I first had sex. And so I couldn't drive. Telling this story now, like, God, I cannot imagine. So I couldn't drive. So my mother picked me up from my boyfriend's house at the time. And I got in the car and I said, I had sex. And she was so she was like, "What?" And I said, "I want to get on birth control." She's like, "So you're gonna do it again?" And I was like, "I think so."
Oh my God. I love this story so much.
So yeah, I can't.
I love how open you guys are. Oh my gosh, my mom.
So yeah, I can't. I can't go down this path. My story is different.
I love it. I love it. Well, I mean, number one, I think that's a testament to having an open relationship with your child because you obviously felt comfortable enough to tell her. And that is a wonderful thing. So good job, Anne. Anne's like, trauma.
I know. She's like going into
sorry.
shock right
I will
now.
give you a free session, Anne, after this podcast. But think about that. So like you've had your period for maybe we'll say 5 years. I don't even know. I was in 6th grade. What are you in 6th grade?
You're, I think,
like 12.
Yeah, maybe.
Yeah.
9, yeah. And so I think I was in 7th grade.
Yeah.
Yes. Yes. Cause I was in band and I remember I was like, oh shit.
Yeah. I was driving home from Vegas and I could not stop crying.
Oh,
I wasn't driving. I was in 6th grade.
I hope not.
I have a funny story about periods. We should have period nightmares.
Yes. Oh my God, please.
Yeah. That would be hilarious. But
okay. Anyways,
yeah, think about that. So your body's only been producing its own hormones for X amount of years, and then you start putting these synthetic hormones into it. Like it doesn't even have an opportunity to like figure its shit out before it starts making its own.
Right.
And so again, that's post-pill PCOS.
Well, and I want to add something to that. Hang on. Sorry. So with the post-pill PCOS too, like when you get put on the pill so early in life, it's because your period is irregular per se. Your period's supposed to be irregular when you're younger. Like that's just kind of like the developmental of your body figuring out like this hormone shift too. So that's something that's overlooked as well. So like, oh, well, I was put on for my period being irregular, but it's like, I mean, was it irregular for like 5 years or was it irregular just in the beginning? Because that's a big difference.
I didn't have a period for a year.
Yeah.
After like having it a couple times, but I was also like 12% body fat. So yeah, I was dancing every day of my life.
Inflammatory.
Yeah.
Yes.
Yeah, inflammatory PCOS. So this is chronic inflammation. So we've talked about inflammation. Inflammation is necessary in the body. We have three places that inflammation increases. So obviously your immune system, that's like what I feel right now. I have this mucus. So obviously there's some inflammation in my body. You have gut inflammation, and then you have inflammation like in your skin, if you will. And so inflammation is good because it protects us from, these invaders, if you will, in our body. However, if we have chronic stress, if we're eating a diet that's like super high in inflammatory foods, right? So think like really processed foods. If we have toxins in our body, we can see this increase in inflammation. And, that in itself. So if you think of inflammation, like, again, it's good. But when we have this inflammatory PCOS, it's looking at the good inflammation and it gets very overwhelmed by it. So then it actually creates more inflammation in the body. And that can then, I shouldn't say it creates more, it attacks the good inflammation. Okay. So then someone with inflammatory PCOS is going to be very tired, right? They're going to have headaches. They may have like skin conditions, eczema, psoriasis, some of them, again, unexplained weight gain. I would even say like digestive issues, because obviously inflammation can cause that. But there is then a hormonal imbalance that comes with this and worsens PCOS inflammation as well. So that is the third. And then we have adrenal, right? And adrenal is characterized by higher levels of DHEA, which is a hormone, and a hormone that is produced by your androgens and by your adrenal glands rather than your ovaries. It is 1000% stress related. Okay. So the ovaries cause that excess amount of androgens, and just kind of like insulin, it's like too much. So we go into kind of this adrenal dysfunction. Women with adrenal PCOS may have normal insulin levels. Okay. But still experience the irregular periods, still experience the issues with like hair growth, they'll still experience acne. The more stress you experience, the more adrenals will release cortisol. Okay. So remember, cortisol is not a bad thing, but the more stress that we experience, the higher cortisol. Now we have more stress in our body. And so this just makes it harder for your body to manage stress. So your stress management goes down. Then we try to do things, because again, this can also create weight gain. We try to do things like diet, restrictive diet, over exercise. We might, start running or something like that. And now we're just adding stress and adding stress and adding stress. And so that is another form of PCOS. And so the thing about the subtypes is you don't just have to have one. You can kind of have all of them.
Well, what I think is interesting is I think this circles back to the name and kind of the misnomer there is when you say polycystic, so multiple cysts on my ovaries. And when you were describing each of these, you didn't even touch on having cysts on the ovaries for a classification of having PCOS. And so I think, like, again, depending on the doctor and their criteria and their knowledge, that's something to consider as well.
Yeah. Well, and like your overall symptoms, part of that is 12 or more irregular cysts on your ovaries. But again, people with cysts don't automatically have PCOS, right? So that's really important. And you can have PCOS without having cysts.
Correct.
So that's also important. But no, I think that's really good to point out. Obviously, the irregular menstrual periods is a big deal, right? So heavy bleeding, irregular cycles, missed cycles. And this is due to missed ovulation, right? So your body is just not functioning. I think of like your period as like a bicycle, right? Yep. And like all parts are working together. One part, your adrenals, your insulin, your testosterone, your stress levels gets out of whack. And now that whole system is off, right? We talked about cysts on the ovaries, higher testosterone levels. That's we often see. That's what we're talking about, like androgen hormones. So testosterone being that. Women do have testosterone in their body. It's actually a really good hormone in our bodies. We'll see weight gain, right? Specifically around the belly.
Yep.
Another thing that I didn't write on here that I on our notes is moon face. Have you heard of that?
Well, no. What is that?
So you get very like round cheeks.
Oh,
It's called
interesting.
moon face. Yeah. And so that's a part of it. Acne, you can have like oily skin,
Yeah. Male
infertility.
pattern baldness.
Yeah. Oh yeah. Male pattern baldness, or hair growth, right? And that's all androgen related. Infertility issues, which is because of the issues with ovulation, of course. So if I'm not ovulating, I'm not going to be able to get pregnant. But here are some that you guys might not know about is skin tags. Do you know what a skin tag is?
I do.
Yeah. So it's just like little pieces of skin. And you'll see them in like your folds. So like under your boobs, your armpits, between your thighs. But also in those areas, your skin can get very thick and dark. So you'll see even, your neck is another one. Dark patches of skin here, under your armpits, under your boobs, maybe even like in your like genitals. You'll see this thick. So who gets it? Who gets PCOS? Oftentimes it's a genetic thing. So you'll want to ask your mother, your grandmother, your aunts if they have it. That's something we see. But as you guys can tell, there's lifestyle things, decisions that we make, whether that's being on birth control, chronic stress,
High processed food diet.
Exactly. That's a big one. And then from those lifestyle decisions, we could then become overweight or obese, which also increases your chance of getting PCOS as well.
Yeah.
Your ethnic background, early puberty, and so on. So it's tough too, because testing wise, it's, yes, can we see higher levels of androgens in the body? Yes. There are certain hormonal tests that that we can take or we can do, but like I have a client with PCOS. She is on birth control though, so she would have to get off to get a specific, like a more accurate test. Right.
Well, even you can say they test like through ultrasound and seeing cyst on your ovaries too.
Yeah.
Yeah.
Yes, that's a big one actually. So let's talk about like if you have PCOS, like what testing you can get. So first thing we want to do is get your thyroid checked, right? So as we talked about, it's a metabolic issue. There is a correlation again between Hashimoto's and PCOS. So a lot of women will test positive for both. It's advisable to get tested for both TPO and TG antibodies, as they can be positive for many years before thyroid levels become affected. So
TPO
and TG antibodies. Other hormones that can be amiss include testosterone and other androgens. Again, like we talked about, DHEA, I'm going to say this wrong, androstenedione, and dihydrotestosterone, so DHT. Prolactin is often elevated with PCOS, and cortisol, of course, is worth looking into, as well as, let's face it, your blood sugar levels. Vitamin D, vitamin B6, and B12 can be deficient. So we want to look at that, and they recommend getting a CBC, a TIBC, and checking ferritin and homeocysteine levels to assess issues with these particular vitamins. And then the last part, again, is the blood sugar. Regular markers of blood sugar control beyond fasting glucose are paramount, but often don't get done. Hemoglobin A1C and fructosamine, I should say, I'm probably saying that wrong, are great markers of blood sugar control, as is home glucose monitoring. So it's rarely recommended unless a woman is diabetic to do something like a CGM. But for these particular gals over at Girls Gone Strong, they recommend that. So just want to go over testing in general. Those are some ways. And of course, as you had mentioned, ultrasound on the ovaries. Okay, can we just talk about the fact that, like, I don't have a uterus, I don't have a cervix, I don't have fallopian tubes. I have these two little nuggets called my ovaries, and they can't even fucking get it right. they have cysts on them.
I have a cyst on mine.
Like, I ended up in the fucking ER because of it. Multiple times. It's ruined my day.
Yeah.
And like, it hurts. It feels, I was talking to your client about this who has PCOS, and she's like, I have this hip pain. I'm like, are you sure it's hip pain or is it cysts on your ovary? Do you know what I'm talking
about? Yes.
Okay. New client in the group.
Yes. Yep.
That you're doing nutrition with.
Yeah. Mm-hmm.
So I was like, are you sure it's not a cyst or lots of cysts? Because I felt that way. I felt like I had a knife in my side and I thought it felt like really, really bad gas.
Mm-hmm.
What does yours feel like?
Nothing. I didn't even know it was there until I had a baby in my belly.
Oh, interesting.
Yeah.
Yeah.
He was like, oh, that's normal. Some people have them. And I was like, okay.
Right. Well, and that's the thing is like, they have to be big enough because you're going to have like cysts. Like there's an aspect to it that's normal, like follicular cysts, I think they call them. But mine, and it was so annoying. Like I'm crying. I'm hunched over in pain. Like I'm in Brooklyn, New York, going to an ER. Is that where I want to go to an ER? No. And we weren't in like nice part of Brooklyn. And I'm sitting there and I think about John C. Lincoln here compared to that hospital. It's totally different. Like you're in this open room with everyone who's in the fucking ER. And I'm sitting there and I'm crying and I'm like, what's happening? They give me some like pain meds and like I kind of calm down and I get a CT scan. And by the way, it was only $390. It was $400 this whole
Wow.
thing. I know. It's crazy. It was cheaper for us to go to the emergency room on our insurance than it was to go to like urgent care.
That's crazy.
Nuts. Yeah. So for some reason we don't have that insurance anymore. They went out of business. So
I can see why.
So I come back and she's like, oh, you have a cyst. And I'm like, she goes, just monitor it. I'm like, okay, well, what do I do next time I feel this way? She's like, take 2 Tylenol and 2 aspirin. I'm like, okay. I didn't know if you saw me when I came in, but I was in like excruciating pain, but cool. Sounds good. All right. Blah, blah, blah. We talked about all this. 12 cysts. What causes it? Boom, bop, beep, bop. Common complications. Talked about that. What recommendations do we have? Okay, good. So there's a lot more information about PCOS. Like there's a whole topic conversation about birth control. There's a whole topic of conversation about your thyroid. Again, just to help you understand that, like PCOS definitely has a correlation with thyroid issues, which again is why we see a lot of the weight gain struggles. So just coming back to the testing, ultrasound, hormones, thyroid, you should always be getting your thyroid checked, I think. I don't know why that's not like a normal thing.
Well, it depends on how they test the thyroid too, because like some, like your T3 and T4 are normal doesn't mean your thyroid is working normally either.
Well, so the gal that I know, that she is a physician or she's a nurse practitioner, and she went to an endocrine doctor who is an asshole. She goes, well, you have PCOS. You're not going to lose weight. Go on Ozempic. Which I will say, there's some people I follow who microdose for PCOS through semaglutide, but they microdose because it helps with the inflammation. However, she's a nurse practitioner. She's choosing not to go on that. And guess what they tested when they tested her thyroid?
Just the T3.
No, just the TSH.
Oh, okay.
They didn't even test your T3 or T4.
Okay.
And like, how am I the person to be like, did they test your T3, T4? She goes, no, because my THS was normal. I go, and I like just sent her a list of like how if like that's normal, these other things can be abnormal.
Right.
It's flabbergasting. It's flabbergasting. But then you run into, luckily with her, like we have a really great relationship and she's well educated herself. But But some of our clients are like, well, my doctor said it,
I
so
know.
I'm going to do it. Or
Mhm.
someone with a higher degree said it, so I'm going to do it. And I'm like, okay.
Okay.
Anyway. All right. So I want to talk about recommendations in regards to nutrition, but I'm going to
Yes.
talk about them based on the type
Okay.
of PCOS, the subtype. So for an insulin resistant type, obviously our goal is to manage blood sugar, right? And so we talked about managing blood sugar. One of the major things you want to do is eat whole foods because it helps delay gastric emptying,
Mm-hmm.
which will help delay that spike in insulin. Okay. Um, so obviously eating whole foods is going to be important. Eating high fiber carbs is going to be important. There's this misconception that we need to be very low carb for this type of diagnosis. We each have a carb load. So with my PCOS clients, I'm looking at carb load and I'm looking at the type of carbs they're eating. I actually have a really cool resource I haven't shared with you, and I keep telling myself to call you and go over this with you. So you're going to learn about it today.
Okay.
Two
Wait.
birds.
Backtrack. What do you mean by carb load?
So carb load is the amount of carbohydrates that your particular body likes, if you
Okay.
will. So it's not creating these big highs in blood
Mhm.
sugar, but we're getting enough to manage our energy levels. It's not creating a stress state because we're
Mhm.
not getting enough, because that can happen in the body. It's not creating a stress state on either end. It's kind of this like Goldilocks of
Right.
carbohydrate load that you can have. How do I find that with clients? I will take them slowly up or bring them slowly down. So like I have a client right now, we're trying to find her carb load because she's not seeing any movement with her weight loss. And I do believe she's insulin resistant, maybe not PCOS, but just insulin resistant in general. So I bring her down 10 grams, see how she feels. If we don't see any movement in her weight, we bring her down 10 grams again, see how she feels, right? She's not shaky. She's not having massive cravings. She's not getting headaches. And then we'll start kind of seeing movement on the scale after doing that. And we'll just stay at that. Because I always tell her, I'm like, if I can get you eating 130 carbs every day, other keto people will be like, no, you need to be 20 net carbs. Like, if you don't have to be 20 net carbs, then why would we ever do that to you?
Mm-hmm.
So we slowly just bring them down. Another thing, and we've talked about this before, is no naked carbs.
Yes.
So you want to explain that? Because
Yeah.
I'm going to drink.
The no naked carbs is essentially not having your carbs alone. So for example, like a rice cake is a good one if you're, because that's essentially just straight carbs and it's processed, which that's okay. But like if I'm going to have the rice cake, maybe I pair it with avocado and like some turkey breast instead of just having just the rice cake. Or like if I'm going to have an apple, which is a good whole natural food, instead of just having the apple or even a banana, let's pair it with some peanut butter. So like to help slow that, slow that insulin spike is not the right words, but just slow that kind of rush of energy that your body's going to get if you have the carb alone.
Yep, absolutely. And an easy way to think about this, like just from a plate perspective.
Mm-hmm.
So from a plate, it's very similar to everything else we've talked about, right? So your veggies taking up half the plate. Let me see. Oh, did I delete it? Uh-oh, it's not good. I'll find it in my notes. But taking up half the plate, right? And then a quarter of your plate is carbohydrates, a quarter of your plate is carbs, and then obviously you have those healthy fats on the plate as well. But when we're looking at our carbohydrates as well, we want to be high fiber, right?
Mm-hmm.
Now, be careful with fiber, guys. I notice this when we get new clients and they'll just naturally start eating higher fiber foods because they're trying to be healthier. And then they'll get a lot of gastrointestinal issues. Like I didn't know this. I'll take full responsibility of this when I was starting. Too much fiber too soon can cause a lot of gut like pain. So I have a client right now. We looked at her fiber. She was at 8 grams. So I took her to like 15. And then I'll take her to 20, and then I'll take her to 25, right? So just slowing it so you don't get this like, fiber slow down and I think of just like fiber like sitting in
Yeah.
intestines. But fiber, of course, slows digestion, which is what we want. It helps with cholesterol issues, which we'll see again. We talked about this in perimenopause. And of course, it helps to remove the stool, right? So we want to get the toxins out of your body. We want to even just like the metabolized hormones we want to get out of your body. So that is super helpful. And just like every other episode, anti-inflammatory foods.
Right.
So here's the kicker. For a lot of people with PCOS, they don't do well with gluten or dairy. It's insulin resistant type, inflammatory type, PCOS. However, for few of my clients, they're not going to do that. They're not going to remove gluten or dairy. So with this particular client, what we're doing is this. I'm going to have to pull it up in her chart because I just, in an effort of saving time. So I've created a checklist in her tasks. And the checklists are 2 servings of non-starchy vegetables per day, 1 to 2 cups of fruit per day. Now, for her, she knows lower glycemic is going to be better. Okay.
So meaning berries over bananas.
Yes. Think it has to have a skin on it. Okay. 3 servings of a half cup of whole grains per day, 1/4 cup of nuts per day, 3 tablespoons of healthy fats per day. She can have fatty fish twice a week, and she can have 1/4 cup of beans 4 times a week.
So she finds that more easy than just cutting out gluten and dairy, just out of curiosity. Wow.
Yeah. She's like, oh, I can do this.
Oh, I'm thinking the opposite. That's interesting. So, and I think that is, foretelling of the type of way we coach that's very individualistic. And to me, like if I was your client and say I'm in her shoes, I'd be like, I'll just cut out the gluten and dairy. That sounds so much easier.
Yeah. She already ate like this.
Okay.
I went through her current meal plan and compared it to this meal plan. And it wasn't off. The things she was missing were like the healthy fats and reducing processed foods. So there were some processed foods in her diet. So yes, I mean, with any change, it's going to be a change. And so for her, we're still kind of in the process of like making this work, but we have, and this is what I was thinking for your client. We actually have it's from the doctor gal that I forget the name, where you just like mark it off on a piece of paper. Like this is what I had today.
Yep.
But if we're just thinking about it from a plate, you describe your plate how you've described it before.
Like that I have in general.
Yeah.
So I do usually 1/4 of the plate is at least protein. And then half of the plate is usually colors. And then the other 1/4 or maybe even 1/3, depending on how many veggies I have, is the like carbs. So like your potatoes or your rice or something like that.
Yep.
And then honestly, fats are in there as well. So maybe, well, hang on, let me rephrase that. So I've got 1/4 is the protein, probably a little bit less than a half is the what's called the greens and the colors. And then, because I'm having a lot of fats right now. So split the remaining 2 between fats and your starchy items.
Yeah. So just to go over some high fiber foods too, guys. So you've got raspberries, pears, apples, bananas, strawberries, blueberries, veggies, green beans, broccoli, turnip greens, Brussels sprouts, potatoes, sweet corn, cauliflower, carrots. For your grains, your whole wheat, spaghetti, barley, bran flakes, quinoa, oat bran, muffins, oatmeal, popcorn, brown rice, whole wheat bread, rye bread, and then your nut seeds, split peas, lentils. I always avoid the word legumes, but those are in here. Yep. Black beans, baked beans, chia seeds, almonds, pistachios, and so on. And those are just to name a few. This is actually something I have as a shortcut to send to clients because that's a question they oftentimes have. Okay, so that is you're insulin resistant, for your anti-inflammatory, for your inflammatory type, the Mediterranean diet would be really helpful for that. So your high fats, your, again, high fiber carbs, but we want to focus more on like getting in the olive oil, the avocado, the fatty fish. So the Mediterranean diet would be helpful for that. For your androgen PCOS, it's really about managing your stress. That is also true for inflammatory. So getting enough carbs, again, is really important. So learning that carb load is going to be helpful. Eating in the ways that we've talked about is going to be helpful, especially the anti-inflammatory diet for all of them. The insulin resistance is going to be very specific in regards to like no naked carbs, slowing gastro emptying. And then the PCOS post-pill type mimics insulin resistant PCOS. So you'll use similar nutrition guidance there. Now, again, so say you're like, okay, I don't want to do that whole checklist. I just want to cut out the gluten and dairy. At this point in the world, I did a no gluten, no dairy for 3 weeks, and I found it pretty easy.
Yeah.
Like, I went on Pinterest. I found some soups to make. I bought some like gluten-free breads. Yep. The tortillas are horrible. They're so gross.
Would agree.
Yeah.
But like, so even like spaghetti, instead of spaghetti, there's like protein spaghettis from Sprouts. Like there's like an edamame pasta. You could do spaghetti squash instead of rice. You can do cauliflower rice. You can do, what's another gluten, like breads, like you said, just switching for gluten-free breads. Tortillas, you could just do naked, like just do a bowl instead of a burrito. Dairy-free, so like your yogurts get a little complicated because of the protein content, but you can always add but then you can always add like protein powder that's dairy-free. So like just don't get the whey, but there's some other protein powders that are actually pretty good that are dairy-free. Milk, we just don't have milk, or you can substitute with a nut milk. What's another thing that's dairy? I think that's probably about it.
Yeah. Well, they have like dairy cheese alternatives.
Yeah.
Or I don't use this a lot, but do you use nutritional yeast?
No.
I hear it like makes things taste cheesy.
Yeah.
So cutting out, refined sugar would be helpful for that as well. So getting more of your natural sugars from things like fruit, and even like dark chocolate can be something you can have as well. So that's nutrition. So just to reiterate everything, if you are insulin resistant type, we want to slow gastric emptying, eat whole foods, do not eat naked carbs. We want to pair our carbs with a fat or a protein. The other thing too, and I'm going to talk about this in exercise, is like a pre and post workout meal, just to help manage blood sugar levels as well as cortisol levels can be beneficial. That's not for every person. So again, guys, this isn't hard and fast. You will figure out what your body likes specifically. I have many clients with PCOS, and all of them have a different way of approaching it that works for their bodies. But for exercise, and follow the anti-inflammatory diet, you can remove gluten, dairy, sugars, and focus more on like healthy fats and whole foods. So exercise, reducing stressful movement.
Right. So like your HIIT, your long intensive cardio, your group fitness classes even. I mean, like you might think they're not stressful, but they're just a non-beneficial stress on the body, because what you have to remember is exercise is a stressor itself. And so therefore, if we're not listening to our body, having a well-structured program, and we're just doing like HIIT classes every day or HIIT YouTube videos every day, there's not really anything down regulating about that. And there's not anything muscle promoting, which as we talked about before, is the promotion of muscle, the growth of muscle is great for insulin as well. So it's kind of this vicious cycle that you see. And then on top of that, if we're already stressed because of, to be honest, how our body looks, if it's in this like PCOS ideal kind of body type, and not to characterize, but I mean, there tends to be a typical body type if we're talking about weight gain and obesity and the whatnot, that when we're doing these high intensity exercises and cardio over and over again, our body's in a stressful state. Then we're having inflammatory foods, and then we go to work, and then we've got the relationship. So it's not helping.
No, I agree. And I want to just make a point that something you said that you guys think it's HIIT, but I want to explain what HIIT means. High intensity interval training. Yes. Right? Interval is the word I should have emphasized there. Interval. But when you're doing 45 minutes to an hour of high heart rate, we're lacking the interval part of it. And having 20 seconds between your like high intensity work part of it, like the working part of the exercise, is not enough to create an interval, like to create that down process, that rest and recovery, to allow for your body to create more ATP, excuse me, to bring energy back into your system. So the way that I do HIIT is like 10 to 12 minutes. And it's, there's different ways that I do it. But I left that world, God, 3 years ago, I would say. 3 years ago. One thing I wanted to talk about, you made me think of something. This article, maybe it wasn't this one from Girls Gone Strong. So it says, when fat cells are resistant to insulin, they don't respond as quickly to insulin's message to store up. Women with insulin-resistant fat cells gain body fat less easily. And because their muscles take in the nutrients and glucose quickly, they often deal with low blood sugar issues as well as insulin resistance issues. These women are typically called lean type, but refer to them as fat-resistant PCOS. Yes, that is something I think of one of my best friend's moms who had issues with infertility. She's got a lower voice. She is fucking ripped. Never has worked out in her life.
What?
Never. Full pack. So I've not been tested for PCOS, but it would make a lot of sense for me. And I think that would be the type of body type I have. So then you have in women with heavy body type, or what I call the muscle resistance PCOS type, it's the muscle cells that are resistant to insulin. They don't take in nutrients as quickly, and more is stored in body fat, which is sensitive. These women tend to experience more fatigue and exercise intolerance, as well as increased body fat. So you can actually, yes, the majority of women have the latter, but the former is something no one talks about, that you can actually be someone who gains more muscle, because think about it, you have more testosterone in your body, and it's the way that the body is using that. So that's something that I'll have to send. We'll link this. Actually, I'll link this article. Okay. Movement. You really want to focus on recovery.
Yep.
Right. So strength training is going to be your best friend here, not just because it's going to help with insulin resistance, but obviously, as we've talked about multiple times, the more muscle you have in the body, the higher your resting metabolism. So as we had said, PCOS is a metabolic issue. So if we can increase our muscle mass, that's going to help increase our resting metabolic rate. Now, it's not going to make you, maybe this fat burner type, right? But it's going to help. And if you do it correctly with adequate rest in between, as we talked about before, sessions, right?
Right.
And programming, you will allow the body to gain the benefits of strength training without it becoming an added stress on the body, right? Which is exactly what we want to do. You can add a pre-workout snack, right? To give the body, just kind of prepare it so it's not in a stress state going into the workout. That can look like something like 15 grams of protein, about 30 grams of carbohydrates, depending on the intensity of the workout. If you're just doing as we call it, boring strength training program, which is our favorite, we love it. You can just do 15 grams of carbs. What I do is I'll just drink half of one of those Fairlife shakes.
Oh, really?
Right before I go in. Yeah. And then afterwards, you want to replenish the carbohydrates to help manage the cortisol levels in your body. So you can have those 30 grams of carbs. But again, we're not doing that naked. So just like you said, like a rice cake with some peanut butter or a rice cake with avocado and turkey, that's easy. We're not having a full meal afterwards. We just want to replenish the body to get it out of that stress state.
Right.
Speaking of stress, you got to manage stress.
Right. Well, and that includes a sleep schedule, sleep routine. Like stress isn't just I feel stress. And we've talked about this before, and hence stress spelled backwards is dessert. But so stress isn't, it's like managing your sleep routine. So for example, your body could be in a stress state if I'm going to bed at 11 p.m. and then waking up at 4 a.m. to do like this HIIT workout. And then I'm not eating throughout the rest of the day. Stress state can be, work was really stressful today. I got home late. I haven't done my workout. Eating was kind of come and go because I had meetings back to back. That's a stress state. Managing stress in those terms would be, am I meditating? Am I taking care of myself? What is my self-care activity? Or what did you say? How do I make myself comfortable? That's a thing that you have with clients that I was listening to. And I was like, oh, I think I like that better than like self-care, because I feel like self-care has been so promoted as XYZ things. And if I don't do these things, then I'm not really taking care of myself. But it's like, really, how can I make myself comfortable? Maybe it is going for a drive, like, and listening to music. Like maybe that's something that, maybe it is going for a walk outside with the family. Maybe it is watching TV for a little bit. So having consistent sleep, bedtime routine, having comfort activities that allow your body to downregulate, as well as having good relationships, with people. Absolutely. So if you're always in these stressful relationships, or like your mom comes over every day and you can't stand her, we need to talk about boundaries. Those are certain things, that people don't understand, that they all compound, and it's not always one trigger, right? It's always this cascade or this kind of cycle that we're in. Like the bicycle example is a great analogy. The bicycle can still work if the brakes don't work, but when you need the brakes, we're kind of SOL. Right. Or the flat tire, it'll still pedal with the flat tire, but it's really, really hard, but it'll still go. So it's just, I
love that.
Like that.
Yeah, no, so good. You touched on it, and, stress is physical, emotional, cognitive, relational, spiritual, environmental. There's so many aspects of stress that we need to focus on, especially if we are dealing with something like PCOS. All right. So let's talk about what are some other things you can do. So we talked about, we didn't touch on sleep, but one thing with sleep, you can have, similar to like your post-workout meal, like having like a carb rich pre-bed snack, again, not naked, can help with managing your cortisol levels overnight. So we're not also seeing issues with sleep. So that's something that I've done with some of my clients. They'll have like a high fiber, high protein snack at night. And that tends to help them with sleep, but having a sleep routine. Oh, guess what I got? A chili sleep.
Oh, you did?
Yes. Mark found one on fucking Facebook Marketplace. It was like these old people in Sun City. And I honestly just think they couldn't figure out the app. So they sold it for half off. And like, it's brand new. Girl, I go to sleep at like 67 degrees and I wake up at like 76. It wakes you up with the warmth.
Yeah.
But then I don't want to get out of bed. Right. Because I'm so cozy.
Yeah. And just wait till the winter too.
Oh, fantastic. But coming back to this, you can buy a chili sleep. They're very expensive.
That would be a supplement.
Yes. Going to bed at the same time. We've talked about
waking up at the same time.
Getting sunshine on your face first thing in the morning, and reducing lights, reducing any noise in your head. So journaling could be good. Even just putting your legs up against the wall can be helpful, just to kind of relax your nervous system. Or, as Amanda just said, even just doing like a meditation or sleep story is technically a meditation. You can do that as well. But managing your sleep, because again, as we talked about, when sleep is off, hormones are off, and that's something we want to avoid. Yeah. All right. Let's talk about supplements. So there are certain supplements for certain types, but I want to just bring this up that like your vitamin D, B12, and B6 are usually something that are out of whack during this time. Now you want to get those things tested. So let's add that to the testing list. But for specific types of PCOS, you have specific supplements you could take. Now, we are not doctors, so you want to speak to your physician about this, your physician who specializes in PCOS. So for the insulin resistant type, inositol, which you're taking to manage your blood sugar.
I take that.
Right. So inositol powder, inositol pill can help regulate your blood sugar, which is what we want. For the androgen type, palmetto helps in regulating androgens, which can reduce stress. You'll see that similar in the post-pill type. Again, the best thing for you in both of those is managing stress overall. For something like inflammation, you can look at things like licorice or ashwagandha. These both can help manage stress, but some of, I believe it's ashwagandha if you're taking thyroid medication, there may be a little bit of they don't play well in the sandbox together. And so definitely want to speak to your doctor about that. And then also in regards to like medical treatments, things like metformin for managing blood sugar. There's anti-androgen medication that you can take. And that's all I found. I don't know if you have anything else.
When I went to lunch this weekend, they were talking about sometimes using, and you mentioned it, I think earlier, the GLP-1s.
Oh yeah.
But that's like, again, not just a small dose that's from a compounded pharmacy that works with you would be best recommended.
Did your gals, I know that it was Dr. Lisa, right, that you went out with?
So I went with Dr. Lisa, who's the chiropractor bodywork specialist. Then I went with Dr. Erica Wattis, who's a primary care physician, but she does like concierge practice.
Love.
And she does my medical stuff. And then I went with Samantha Jerome.
House?
No, we all went to dinner, our lunch at Flower Pot.
Does her concierge practice come to your house?
She does virtual. She's great. Yeah, I love her. And then we went with Samantha Jerome for the dietitian.
Yeah. So Samantha and I used to work together at an eating disorder facility. Shout out to Sam.
Yes.
So proud of her. She was like a intern.
Yeah. She's got her own business now. Actually, well, all four of us do, essentially.
Yeah. Well, I saw that Dr. Lisa had her on something and I was like, I worked with Sam. So I love it.
Yeah,
I need to just insert myself into this network.
You do. So, but because I asked Dr. Wattis, I should say, not Erica, Dr. Wattis and Samantha, because they co-treat a lot of patients together. And so I was like, because last time I saw him, Samantha was one of the first ones that I talked to about GLP-1s. And so that was probably over a year ago. And then Wattis, and so actually all four of us have co-treated patients and clients and whatnot as well. So they're three of my big referral sources for in-person clients. And so I had asked them about GLP-1s, and there's a particular client that all four of us has shared, and she has PCOS. She's got like all of these symptoms that we're talking about. And they're like, honestly, we would consider like, we're not opposed to GLP-1, but it depends on the client too. And like the patient, I should say. And so I asked him about like the compounding pharmacies and like versus the, like, I called it like the big pharma doses.
Yep.
And they were like, oh no, yeah, you've got to go to the compounding pharmacies. And because you just need a minimal dose. And what we wanted, like the same thing we talk about. So, yeah, we should have them on because they're fabulous.
I talked to Dr. Lisa about having her on. So,
oh, did you? On
Instagram.
She didn't tell me, and I just saw her today. That little hoe.
She's the one that like you always send me her stuff, right? Maybe it's a different doctor.
Dr. Lee Lewis?
I don't know. We'll have to look.
Okay. Like which
anyway.
Okay.
No, I agree with that. I sent that to my client. I was like, you need to find someone who's going to microdose this for you. Yes. Like it's going to provide you. And that's the thing. Like, I think I have a few clients who've actually tried like the big pharma dosage, and they hated it.
Yes.
And they would definitely benefit from, some microdosing as well. Now that's the thing is like, it can definitely get them down and get their weight down and all of those the wonderful things. But did they talk about them having to use it forever?
We did. So they talked about some people have to use it forever and that's okay. And then some people, we eventually get off it. But just like, they're literally on the same page as we are. They talk about you have to work on the behaviors. But a lot of times the issue with the GLP-1s is the GLP-1s shut off like your signals. So you're not learning your behaviors. And so what they'll either see is like people will just like, oh, it's 8 a.m. I need to eat. Oh, it's 12 p.m. I need to eat. Instead of being like, hey, it's like 11:30, I'm a little hungry earlier, I'll probably go and eat something. So they're like setting up their day to follow this path that they're not listening to their body. And then also like, especially trying to understand like, what is my body asking for and whatnot? And like, why is it craving carbs? Why is it craving sugar? And so they're very like, it depends on the client, but one of them shared an experience where one of the people was taking it. She wanted like the final weight loss. And so the doctor that was prescribing it at the time, like bumped her up and she ended up getting the gastroparesis stuff that's you can get with it. Couldn't drink water, was throwing up, could not have anything. So she called one of the providers at like 9 p.m. and they were like, you have to go to the ER. Like we can't do anything. Like I can't do anything for this. And, she went to the ER and she's like, you also need to stop it immediately. But the problem is it stays in your body too. So like it would be, if we have Sam on, we should, or any of them, well, Erica and Sam, we should have them talk about it because they have, they both work with it. They both prescribe it. They're not opposed to it, but they are like, if you're going to, just like Dr. Tina and us, like if you're going to do this, like you have got to like have a program. You need to work on the nutrition aspect. You need to work on the mindset piece. And if you're not doing that, we're not going to keep doing this.
Yeah, no, that's crazy.
Yeah.
That's crazy. No, good. I will be a guinea pig. I am not opposed to just apparently injecting myself with shit. Just kidding. I am actually.
You do like to test. You do like
to test things. I tested a peptide once, and that was terrible.
You didn't like that.
Being like 10 pounds. Okay, so that's a pretty decent overview. Please let us know if you guys have any questions. We'll continue to elaborate on such topics and have experts on to speak to this as well. But again, as we're speaking about it, a lot of women, I've worked with thousands of women all over the world, and they have had these specific symptoms, and a doctor's like, oh, you're fine. It's fine, and they feel like shit. So remember, at the end of the day, if you don't feel right, get a second opinion. Get a second opinion, and birth control is not always...
a third opinion, too.
Yes. Birth control is not always the answer.
Nope.
So good. Good?
Yep.
All right. Well, thank you guys. Again, we hope you enjoy this information. If you do enjoy it, please give us a follow on Apple Podcasts or Spotify. You can subscribe. Please rate and review, comment. That helps us get to other individuals out there in the world. If you can also give us a follow on social media. Myself and the team are at Mindset Matter Coach. What is it?
Mindset Up Matter.
I don't know. Where do I live? Who am I?
I know.
Mindset Up Matter Coaching on Instagram. And Amanda is at fitbyamanda.az. You'll find us on YouTube at The Mindset of Matter. And if you are interested in setting up a call with us, say you do have PCOS, as you can tell, there's so many different symptoms, approaches. It is very much something that we need to have customized to you in regards to the approach of how we change your lifestyle. We will have the link for our clarity call, which allows us to understand your needs, and then you'll walk away with the best recommended steps to move forward. So that will be in the show notes below. But if you have not been listening and you just tuned in and you just want to remember one thing from this podcast, we want you to remember this.
What you say in the mind,
you see in the mirror. Bye-bye.
Bye-bye.